He's joining us now in the Element Wealth Studios, kicking off the afternoon portion of the show. Representative Lee Yancey. He represents District 74, which includes Rankin County. He serves as the chair of the House Drug Policy Committee. Representative Yancey, good to see you. Happy New Year.
Great to be here, Gerard. Thanks for having me on.
You bet. So you guys have been down there at the Capitol getting ready to make them laws. You've been at it for a little over a week here, week and a half, almost 2 weeks.
It's like a locomotive getting going. It's just taking off very, very slowly and chugga, 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 and pretty soon we're going to be going full speed.
Yeah. So when's the deadline?
So we just had a deadline to introduce general bills last Wednesday, and I think those bills have to be dropped by Monday.
Okay.
And then there'll be another deadline for appropriations bills later on. I think it's near the 1st of February.
Okay. So we're getting there.
Getting there.
Yeah. What's coming out of your committee, the Drug Policy Committee?
So the Drug Policy Committee, obviously we're still making tweaks to the Medical Cannabis Act that we passed last year, and just trying to make that work more smoothly. A couple of places that are bumpy. I think 2 background checks are required for an employee of a dispensary when 1 background check would be sufficient. Department of Public Safety didn't feel like they had the authority to conduct a federal background check for a Schedule I drug, and so we were trying to get language for them in order to do a background check on those who work in the business, the background check covering the entire country rather than what we're doing now, which is just the state. So just trying to make some things a little smoother. I'm not looking to make big changes until we know exactly what we've got. We haven't sold the first product yet. So we need to know, we need some data to see what's working and what's not working before we, start fiddling with it too much.
So where do we stand while we're talking about that? I thought we were supposed to have retail sales cranking up the end of November, was what we were told.
Well, the testers have been licensed, at least one, and one has been licensed for flower only, and they're working on getting licensed for their other concentrates and edibles and things. And it looks like there will be product in the dispensaries probably in the next week or two. So the testing facility in Natchez is open and running, and the one in Flowood is open for flower, and they're getting very, very close. So there's another testing facility in Holly Springs. There's another one that's being opened in Meridian that's a few weeks behind these others, and I know of another on the coast. So we are a week or two away from the first products being sold, and actually having some data that we can work with to try and get the program where it needs to be.
Okay.
Some of the other issues, we're always dealing with these gas station drugs like kratom and tianeptine, and what I'm looking at doing this year is just kind of turning that over to the health department, to the state health officer, and creating a screening and approval program for the retail sale of products that are sold over the counter that have addictive properties, the tendency to be used and abused, and that would cover a lot of different drugs and drugs that don't even exist yet. Rather than us having to continually bring these before the legislature, having a bill to schedule this one or a bill to schedule that one, let's just let's put this in the realm of medicine and science rather than in the realm of the politicians. Yeah. And lots of things are being sold in the gas stations now that don't need to be, and our kids are able to get their hands on some of those things, and they're not good. They're addictive. They have the same properties as opioids. They attach to opioid receptors in the brain like opioids do, and people are getting addicted to some of these things, and we need to have someone taking a look at what's being sold.
This came up last year in the session, did it not?
It did. We passed a ban on like kratom in the House, and the Senate didn't take it up, and then there's also tianeptine. There are people who think kratom has value and has helped them get off of opioids or helped them with PTSD or whatever. Yeah. No one has called me to say tianeptine is a good thing. no one in the world has tried to touch base with me on tianeptine.
Yeah.
Kratom, according to the Mississippi Bureau of Narcotics and according to the State Medical Association and experts and psychologists who counsel people who have drug addiction, they all say kratom is bad. But there are some who use it who say it's not. So the federal government has kind of kicked the can down the road, hasn't made a final decision on it, and so I think maybe there are some who don't want to get ahead of the federal government in scheduling it.
Yeah.
I'm working on some other bills. One is a water safety bill that would. A mother came to me who had lost her child to drowning, and this bill, it comes out of Florida, but the bill would require schools to give kindergartner parents a list of where swimming lessons are taught in the area. And they can do that with a handout, or they can do it with an email. There's no money involved in the bill. If the family needs financial aid to take swimming lessons, there is a foundation in Florida that is willing to provide scholarships for kids to take swimming lessons. And it's called Every Child a Swimmer. And it is a way to just make parents aware that learning how to swim is important, and we try to cut down on the drowning deaths. I asked the Department of Health for the numbers on how many kids that we have who drown each year, and it's like 5 to 10 kids every year drown in a swimming pool or in a creek.
Huh.
And this is to be a valuable tool that they could have for the rest of their life, and it doesn't cost the state anything. Just to make them parents aware of where swimming lessons are taught.
Yeah.
And just being aware will cause more of them to get their kids there.
Who's the committee that would deal with that?
That committee, let's see, it's House Bill 13, water safety, public schools, maybe education.
Okay.
I'm thinking education.
Okay.
So that's one of the things. Another thing, last year we passed Cole's law that said you couldn't discriminate against a person with a disability for an organ transplant, and whether you have Down syndrome or you have some other disability. And I'm trying to get this language out of the Mississippi Code, like the words mentally retarded. I'm trying to replace that terminology with intellectual disability, just to bring it up to modern terms and not to have the stigma associated with mentally retarded, and to try to be a little more sensitive. And it's, again, something that doesn't cost anything. It's just something that updates that. Also, we have a problem with some parents not paying child support. And so, again, this year
Really?
I have filed a bill, with the Lottery Commission. If you win the lottery, your winnings are withheld and sent to your child if you owe child support. And so I wanted to do the same thing with casino winnings, and so this bill would require procedures to be put in place to intercept casino winnings to give to the children if there is an arrearage in paying child support.
Yeah.
So that's another thing I'm working on. I'm still trying to go after the certificate of need process. I think it is an unnecessary regulation that prevents competition in the healthcare field. I don't think that you should have to have a certificate of need to open, a place for,
to provide medical services, right?
A chemical dependency service, an ambulatory service center. I think that, this is free market, and if anyone wants to open a clinic that is closer to where someone lives, that is better for the consumer.
Yeah.
And, it drives down prices, it drives up quality, and we're going to keep pushing on this CON issue until we get some relief. Another thing,
I got to
sure.
start. I've been crusading on this for 20 years, it seems like.
Yep.
And it just seems like every year, Representative Yancey, there's interest, but it just never gets out of committee.
Mm-hmm.
Do you think we may see something now?
We could possibly see something now. It may be now, it may be next year or the next or the next. Sometimes it takes years and sometimes decades to get to good policy. But I believe good policy is good politics, and I'm going to keep pushing for good policy to have, a crack in this CON language so that we can have more competition in healthcare.
I think it's one of those things that probably the average citizen is not aware of. But in essence, if you want to build a clinic, a hospital, add beds to your hospital, buy certain equipment,
absolutely,
it's things like that, you got to get permission from the Department of Health to do it.
Yeah,
that's the way it works. We're taking a break. You stay with us?
I can.
We got Representative Lee Yancey from Rankin County in the Element Well Studios, coming right on middays with Representative Lee Yancey from Rankin County in the Element Well Studios. Okay, so what else? Tell us about the fentanyl testing strips. Is something else you're taking a look at? Yep.
Fentanyl testing strips are something we've been talking about for a couple of years. I didn't really know what they were last year. Also, not only fentanyl testing strips, they have some fentanyl testing wipes, like a wet nap almost, that you could touch it on a pill, and it'll turn a different color if the pill has fentanyl in it. As you know, there's an opioid crisis going across our country. There are many young and old people, but a lot of young people who are dying from taking pills. We try to get the message out. One pill can kill. There are a lot of people who make mistakes and go through seasons in their life when they experiment with drugs. And a lot of the kids that are in our colleges are given a pill at a party or something like that. And we don't want that kind of mistake to be a fatal mistake. And by offering to put these fentanyl testing strips or testing wipes, just decriminalizing it. Right now it's on the paraphernalia list. It would be like something they could add on as a penalty if they were prosecuting someone who was pushing drugs. But this would help someone to know whether the presence of fentanyl was there and would save their life if they, didn't take it. Some would argue that this might promote drug use. I would say people who take pills are going to continue to take pills, and if we care about whether or not they live or die, we need to show a little grace and decriminalize these fentanyl testing strips and give them a chance to have a second chance, to have a life, to get past this season of their life. I would say to all college students out there right now, don't take pills. Don't take anything that wasn't prescribed to you by your doctor or, over-the-counter medication, normal things. Don't take a pill at a party. One pill can kill. You don't know what's in that pill. And but for God's sake, if you do take one, test it for fentanyl. Make sure that it's not going to kill you if you take that pill.
Yeah.
And I think why not? Why not try to save lives? And it makes sense to me. Another bill I'm working on is an income tax credit to rural hospitals. So, for instance, let's say you owe money to the state tax commission. Rather than giving some of the money that you would owe to the tax commission, you can choose the rural hospital of your choice and give your money to that. You're going to pay the tax regardless to the state of Mississippi. So let's say you owe $100 in state tax. That's probably what you owed last year, Gerard.
Yeah, $100.
So you could give $50 to the state, and you could give $50 to the rural hospital of your choice, and your tax liability would be satisfied. This is up to $5 million. At that point, it gets cut off, but that's what it would basically cost the state. It wouldn't receive that $5 million.
I like it.
But it would go to a rural hospital. And also, I am working on basically an ESG bill for the PERS. If I'm investing, if I'm a state employee or I'm a school teacher, and I am working hard, and part of my money is going into PERS for me to have a pension at my retirement, I want to make sure that those who are investing the funds are doing so to try and get the maximum return for me. They're not investing for some environmental or social governance kind of motive. For instance, let's just call it what it is. There are some who will not invest in oil and gas anymore. There were some who, say we're only going to invest in electric vehicles, even if that stock is performing more poorly than an Exxon stock or a Chevron stock. And what we're saying with this bill is that in order for something to be invested for a state employee, you have to be a fiduciary. You have to put their interest above your own, and you are trying to find a way to get them the maximum return they can get. You're not trying to participate in some type of social experiment.
You could argue that they're in violation of their fiduciary responsibility for putting those sorts of social issues above their primary mission and their function, which is to maximize return on the investor's money.
And it's just getting crazier and crazier across our country.
No
sometimes
doubt.
I think, sometimes I think in Mississippi, we have our issues here, but generally, it's the voice of sanity when we compare it to what's going on in the rest of the country.
No doubt.
And so I think that's an important bill. So, I'm doing bills for the city of Brandon and for Rankin County, and working on a number of things that would be helpful to my constituents.
Okay.
But at any rate, we've got a lot going on, and, glad that the session has finally started, and we're going through the process of getting all the bills introduced, and the speaker is assigning those to different committees, and our committees have already begun meeting. Some have begun meeting, some will begin next week, and we'll get those bills voted on, some of those bills voted on in committee, and then they'll come to the floor.
So on the program last week, the Speaker made it clear his top priority is still to eliminate the income tax. And then yesterday we had House Ways and Means Chair Trey Lamar also make that statement. It is obviously in his wheelhouse, in his committee.
Sure.
So where do you think we're going to go on that? You got a feel?
It's all going to come down to a conversation between the Speaker and the Lieutenant Governor. And there's going to have to be something worked out as to what direction we go. The two of them have a great amount of power in that either of them can stop anything in the state from happening legislatively.
Right.
All they have to do is not let it come up. But in order for something to pass, both they have to work together. So, working together sometimes is harder than than you might think.
Yeah.
And there are different good people can have different opinions about ways to go about eating the elephant, if you will. So one bite at a time. But it'll all come down to what they can work out and what pressures are applied from outside the Capitol, and the monies that we have come in. We've got our coffers overflowing. We've got more money than we've ever had. It is a great time to use that money to eliminate the income tax. That would be something that would be an ongoing benefit to the citizens of Mississippi. I think giving something a one-time check. That's. You've heard the old adage, you could give someone a fish and they'll eat for a day, or you can teach them the fish and they'll eat for a lifetime.
Yeah.
We can give them a check this year for $500 or whatever, or we can eliminate the income tax and they never have to pay it again.
Yeah.
So, to me, that's a much more effective way of returning the money to the taxpayer.
Yeah, I'm just not sure that the taxpayers really are interested in just a one-time, what would amount to a fairly small rebate.
Right.
I think they're looking for something that is more than just the financial aspect of that, but something that really just changes the structure of taxation in the state of Mississippi and positions us as a better place to set up shop and do business and live.
Absolutely. I think there are a lot of people who would see Mississippi as very much more business progressive and friendly, to be able to come to a place that lets you keep more of your money.
All right. The other thing that I have described as unfinished business from the last session is the citizen ballot initiative process. As you know, we had a House version, a Senate version, couldn't come together on that, didn't get any legislation across the finish line. What do you think's going to happen there?
I think that there is a consensus that there needs to be a ballot initiative process, but there needs to be a very high threshold for getting something on the ballot so that we don't become like California and have 9 or 10 ballot initiatives every time there's an election. I think there is just, frankly, some fear that some don't want to expand Medicaid and some do, and some who, we put that out there to the state, you're letting them vote on fiscal issues for the state that affect the budget, and there are issues that could be voted on that frankly aren't that popular with Republicans.
Yeah.
And so I'm not on that committee and don't have a dog in that fight, other than I do think there needs to be a ballot initiative process. I just think there needs to be a high threshold.
Okay. Well, so we'll see where that goes. The House, the bill that passed the House last year, of course, maintained the same threshold as currently is in the Constitution.
That's correct.
12% of the total ballots cast in the last governor's election. The Senate, on the other hand, their threshold was 12% of the total registered voters, roughly twice that of the House.
I think there are ways to collect signatures a lot easier than you used to collect signatures, and so that's being taken into consideration.
Okay. We'll see where all that goes. Representative Lee Yancey from Rankin County has been our guest on Middays. Appreciate you coming in.
Thanks for having me today.
Soon. Yeah.
Pleasure to be here.
You got it. We're coming right back in the Element Wealth Studios.